Sleep disorders are a wide-ranging group of disorders that affect the way people sleep and the way they rest, which of course affects the way they feel in the daytime. The most common sleep disorder that we treat is obstructive sleep apnea. We also see some of the more esoteric disorders like narcolepsy or restless leg syndrome and insomnia as well. Sleep apnea is a common condition which affects millions of Americans. It's a situation where people don't breathe and sleep simultaneously. When we all go to sleep, our muscles relax. That includes the muscles that make up our throat. And with normal sleep, everybody's throat caliber narrows. In some people, just based on their anatomy, shape of your jaw, size of your tongue, the most important factor is the amount of muscle and fat in your neck. Some people narrow enough that their throats literally obstruct, occlude, close down with the normal muscle relaxation of sleep. This leads to drops in oxygen levels and leads to the patient repeatedly waking himself up all night long in an effort to breathe. These awakenings are generally subconscious. People don't know they're doing it for the most part. The main symptoms of sleep apnea involve snoring. We'll often be told by a bed partner or by a deer camp buddy or that kind of situation that someone makes very loud snoring noises, which are punctuated by periods of time where they seem to quit breathing. Those are the hallmark symptoms of obstructive sleep apnea. People who are at higher risk for apnea are people who are overweight. 80% of sleep apnea patients are obese. People with sleep apnea report daytime fatigue, lethargy, frank sleepiness when they are engaged in boring activities. They have short-term memory loss, lack of energy, just don't feel like attending the activities of daily living. Once women go through menopause, whether that's surgical or natural, their risk for sleep apnea are the very same as men. It is mostly a weight-related phenomena. That's where we see most of our risks for this disorder. You can access the system in one of two ways. You can tell your primary care physician, who can then call and make you an appointment at the Sleep Disorders Laboratory, or patients can directly call the laboratory. Once a patient calls us here at Mississippi Sleep Disorders Center, they're seen by one of our sleep center specialists, evaluated to be sure in fact sleep apnea or some other sleep disorder is what we need to be looking at, and then they're arranged to have studies done if that's indicated. Everybody is seen by a physician before a sleep study is ordered. Right now, for obstructive sleep apnea, it's clear that the most effective, easiest, safest therapy is nasal continuous positive airway pressure. We shorten that to an acronym and call it CPAP. But continuous positive airway pressure is a physical treatment for this disorder in which a small mask is placed on the nose that's connected to an air compressor, a little 1.5-pound box that blows air pressure into your nose and into your throat. This pressure is the treatment. It serves as a splint. We literally prop the throat muscles open so that when you go to sleep and relax, there's no narrowing. Your throat stays patent. You don't snore. You don't quit breathing. You don't wake yourself up. Your sleep is normal at night. The next day you feel much better. It's a very elegant treatment, works very well. These are some demonstrations of the different treatment devices used in obstructive sleep apnea. Basically, the theory is all the same. We have a mask interface that delivers air pressure to the upper airway. Of course, there are many different ways to apply this pressure, and we can just see some of the different mock-ups of different types of masks. There are over 50 masks on the market. That tells you there's no one perfect mask. Everybody's face is very individual, and we have to fit each individual to his best mask device. It's been well documented in multiple medical studies that weight loss is a very effective treatment for sleep apnea. Unfortunately, it's also well recognized that weight loss is very difficult for people with apnea that's not being treated. So the first thing we do is get the sleep apnea under control and then get the people on a vigorous weight reduction program so that we can use that as our primary treatment modality. Some alternative treatments include oral appliances manufactured by a dentist. We have a dentist, Dr. Richard Poole, who works closely with us, and Dr. Poole can make devices that help to advance the jaw and prevent sleep apnea. That's done mostly for mild apnea and doesn't have as much utility in more severe cases. Weight loss, as we discussed, is a very powerful tool. It can be a challenge to get weight off, of course, but if that's able to be done, it can be very effective. Those are the mainstay treatments. There are no pharmacologic, there are no drugs that treat sleep apnea. Of course, the other sleep disorders that we treat at the center have different treatment options. Insomnia is treated with a combination of behavioral therapy, of some sleep hygiene techniques, and then the appropriate use of sleeping pills. Hypnotic sedatives is indicated on a case-by-case basis. We treat restless leg syndrome with different forms of medication that can be very effective. And we treat narcolepsy, which is an unusual genetic predisposition to sleep, with very specific medications to improve wakefulness and improve daytime functioning. And then there's a group of people called primary insomniacs who have no reason that they can't sleep. It's just the way they are. Primary insomnia is a disorder all in and of itself.